Good evening and welcome to the hypertension workshops offered by the Town of Windsor Health Department with grant support through the Connecticut Department of Public Health. We will continue with our workshops as we've done in the past with the presentation, and then we'll have question and answer where the recording will stop. And then we'll conclude with a demonstration of this blood pressure self-monitoring device. I'd like to remind you that it would be important to complete the evaluation, and you need to complete one of the pre-diabetes screening forms and will be awarded gift cards for each workshop that you attend. A reminder that this is an educational program and is not intended to be a personal consultation for your individual health plan. You should contact your subspecialist or your primary care physician for that information. Hope that many of you can join us while this will be in progress, and also remind you that these are archived on the Town of Windsor website, so can be watched again if you have questions following the presentation. And with that, I'm going to turn it over to Kristen Marty, who's a pharmacologist at Hartford Healthcare or Hartford Hospital, correct? Mm-hmm. All right, Kristen, it's all yours.
Thank you. All right. So hello, everybody. Like Jenny said, my name is Kristen Marty. I am a pharmacist at Hartford Hospital. And I was invited to come speak tonight to discuss high blood pressure and pharmacology. Well, this presentation will be going over some medications and sort of lifestyle modifications for patients with high blood pressure. So here are the objectives of the presentation that we're going to be going over tonight. We're going to be recognizing common high blood pressure medications and explaining how they work. We'll define high blood pressure treatment goals and discuss how to achieve these goals. And finally, we'll be identifying coexisting medical conditions that are associated with high blood pressure. Okay. So first, we're going to start talking about common high blood pressure medications, which are also known as antihypertensives. So another name for high blood pressure is hypertension. So antihypertensives are the term that we use for medicines to lower blood pressure. So we'll talk about different medications and where they work. There's essentially three places that antihypertensives work. These medications work in the heart, the blood vessels, and the kidney. So we'll start with medications that work in the heart. So of course, the heart is what pumps blood throughout your body, and it's really, looking at that force of contraction and the rate of contraction. So how strong and how fast the heart beats. So this is the first group of medications we'll talk about, and these are our calcium channel blockers. Calcium channel blockers are medications that work by reducing your heart rate and reducing the force of the heart contraction by preventing calcium from entering the heart muscle cells. So calcium is very important for heart muscles to contract or to beat. So by blocking that calcium from entering, we reduce the heart rate and the force of heart contraction. Some, calcium channel blockers that work like this, I have two listed on the screen here. Those medications are diltiazem and verapamil. Some side effects of these medications include headache, leg swelling, and constipation. There may be more side effects, but generally these medications are very well tolerated. So, when you're on one of these medications, it's important that you watch out for a heart rate that may be too low, or blood pressure that may be too low. The next group of medications we'll talk about are the beta blockers. And these medications you can see listed on the left side here, they all end in the same, three letters, LOL. So those include atenolol, bisoprolol, carvedilol, labetalol, and metoprolol. These medications, again, work by reducing the workload on the heart by lowering your heart rate and the heart's output of blood. So in addition to, low heart rate and low blood pressure, some side effects of these medications include fatigue, dizziness, and it may mask signs of low blood sugar. So if you are a patient who has diabetes and you are monitoring your blood sugar and you notice that it's low, but you don't notice any signs of it, that may be a result of beta blockers. So those are the two groups of medicines that work in the heart. We will next talk about antihypertensives that work in the blood vessels. So essentially, you can kind of think of a blood vessel like a hose. The wider the hose is, the more blood that will flow through, the less pressure. But as the hose constricts, the pressure in it increases. So as your blood vessels constrict, your blood vessels, there's more pressure of the blood in the blood vessels and leads to higher blood pressure. So again, calcium channel blockers can work in the blood vessels also, but there's different calcium channel blockers that work in the blood vessels compared to those that work in the heart. So these medicines include amlodipine, felodipine, or nifedipine. These calcium channel blockers work by relaxing and opening the blood vessels throughout your body to lower blood pressure by preventing calcium from entering the muscle cells and causing contraction. So essentially, they prevent the blood vessels from constricting. So some side effects of these medications include flushing, and that's because it helps dilate the blood vessels. It can also include headache, leg swelling, and constipation, just like we discussed with the other calcium channel blockers. The next group of medicines are what we call ACE inhibitors, or angiotensin converting enzyme. These medicines include the ones on the left, and they all end in pril. So those include benazepril, enalapril, lisinopril, quinapril, and ramipril. Again, these medicines work by relaxing and opening the blood vessels in your body and kidneys to lower blood pressure. Some side effects of these medications include cough. This cough is usually more so of a naggy, dry cough that is just kind of pesty. So if you do experience a cough while you're on one of these medicines, it's probably best that you switch off of it because the cough probably won't go away. These medicines can also cause high potassium. So it's really important that you restrict how much potassium you're eating while you're on these medicines, or your doctor will just have to closely monitor your potassium levels. These medicines can also cause some renal impairment. So it'd be important to be cautious in patients with kidney disease. And it can also cause facial swelling. Facial swelling is a pretty severe side effect of this medicine. It is rare, so don't want you to get worried. However, if you do have any sort of facial swelling or tongue swelling or difficulty breathing, that can be a severe side effect of this medicine. So definitely important to seek emergency help right away. So the next group of medicines are what we call Arbs, or angiotensin 2 receptor blockers. These medicines are very similar to the ACE inhibitors we just talked about. These medicines include losartan, valsartan, irbesartan, and olmesartan. And these medicines work by preventing blood vessels to constrict. Again, opening blood vessels and lowering blood pressure. Similar side effects to the ACE inhibitors, including cough, high potassium, renal impairment, and then that rare side effect of facial swelling. Next group of medicines are what we call alpha blockers. These include doxazosin, prazosin, and terazosin. These medicines work by reducing the muscle tone in the artery walls to relax and open blood vessels. Some side effects of these medicines include headache, dizziness, and of course, low blood pressure. Other medicines that are just sort of non-specific and just work by relaxing and opening our blood vessels include clonidine and hydralazine. Again, headache and low blood pressure are the most common seen side effects with this. Okay, so the last place we'll talk about where antihypertensives work is the kidney. So we'll talk about diuretics, which aren't necessarily antihypertensives, but these medicines work by helping your body get rid of excess water and salt by increasing how much you urinate. So essentially, these medicines are what we call the water pill. Diuretics kind of help turn the kidney faucet on, as you can see in the picture here. So by turning the faucet on, it allows for your body to get rid of more water through, how much you urinate. So by getting rid of that excess water and salt, that can help lower your blood pressure. So there's many diuretics that you may see. Just a few that I have listed on the left-hand side here include hydrochlorothiazide or chlorthalidone, spironolactone or triamterene, and then probably the most common ones are furosemide or Lasix, torsemide, and bumetanide. I did just want to talk about some counseling points with these diuretics because, they're pretty common that, they may cause some electrolyte abnormalities, which means that your healthcare provider, so, your doctor will want to monitor your blood levels of these electrolytes, including sodium, potassium, magnesium, and calcium. So you may have to go for blood work pretty frequently while you're on these medicines. As I said, diuretics work by increasing how much you urinate. So it's very important that you take, we usually recommend that you take these medicines early in the day to avoid having to use the bathroom at night. So as a general rule of thumb, I say don't take it later than 4 p.m. unless otherwise prescribed by your doctor to do so differently. But taking it before 4 o'clock in the night keeps you from having to wake up to go to the bathroom at night. And then again, these medicines work by, helping your body get rid of water and lowering your blood pressure. So you may feel lightheaded or dizzy when taking this medication, especially when standing up. So if you're ever going from a laying down to a standing position or a sitting position to a standing position, it's just important that if you feel dizzy, to take it slower. So that kind of concludes the medications piece that we're going to talk about tonight. Obviously, there's a lot of medications and a lot of info on them. So I just wanted to kind of provide a brief overview on all of that. So the next piece of information that we'll talk about is blood pressure goals and how to achieve these goals. So on the slide here, I have a lot of different numbers. So we'll kind of go through this and how to kind of explain how to understand what a blood pressure reading means. So for a normal blood pressure reading, we say that would be less than 120/80. So I just said two numbers there. So the top number is what we call the systolic number, and then the diastolic number is the bottom number. So we look at those two numbers to see, if your blood pressure is high or low. So normal blood pressure is less than 120/80. And you've probably heard terms like that if you go to the doctor's office and they take your blood pressure. We say elevated blood pressure is anything from 120 to 129 over a blood pressure of a diastolic of less than 80. High blood pressure includes any number that's greater than 130 or greater than 80 for the diastolic blood pressure. So if you have a blood pressure of, like 130/80, that's technically high blood pressure. And there's different stages of hypertension or high blood pressure, depending on how high your blood pressure actually is. And if your blood pressure is critically high, we say greater than 180 over greater than 120, we call that a hypertensive crisis. That is a medical emergency. So if your blood pressure is ever that high, it's very important that you seek medical attention right away. Now, there's different ways that you can go about achieving your blood pressure goal. Of course, first talking to your provider and coming up with a goal for yourself. We generally say a goal of less than 130/80 is recommended. However, your provider may set a different goal for you. So very important that, first of all, you understand what your goal is. So engaging your healthcare team, that includes your doctors, your pharmacists, the nurses, everybody involved in your care, making sure that everybody is in the loop in terms of what medicines you're on, what lifestyle modifications you're making, so they can help you achieve your goals. It's very important that if you're taking medication for high blood pressure, that you take it faithfully, which means you should really be taking it every day, generally at the same time of day every day, and we really don't want you missing any doses of the medicine. Monitoring your blood pressure is also very important. Jenny will do a little demonstration later about how, to monitor your blood pressure with a cuff at home. And then finally, making healthy decisions. So, watching what you eat, how much you exercise, stuff. So, when I talked about engaging your healthcare team, it's very important that, I said that you include a provider, but, pharmacists, nurses, everybody involved in your care. And it's important that you make a list of questions that you want to ask your provider before you go to your appointment. So, asking, what is my blood pressure goal? What are the best ways for me to reach my goal? And also mentioning what you're already doing to work towards that goal. How much you're exercising, if you're changing your diet, and if you're taking your medications faithfully. That's all very important information that can help your healthcare team kind of, help you achieve your ultimate goal of lowering your blood pressure. It's important that you are honest and realistic with yourself and your healthcare team about what lifestyle changes you've already made. It's always important to be as honest as possible so that we can do our best to help you out achieve these goals. Picking one goal to start working towards is always something that is good, because it's better to tackle one goal at once rather than a bunch of different goals at the same time. So, if you want to change your diet and exercise, maybe pick one to start off with and really nail that down, and then pick the other one to kind of nail down. And then as you achieve success and build confidence, just choosing that other goal to tackle, and always just keeping a running list of those goals. Taking your medication faithfully. So I said that's a very, very important piece to this puzzle. And if it's done correctly, it can, really be effective at lowering your blood pressure. So it's very important that you take your medications as prescribed, whether it's once a day, twice a day, 3 times a day, and try to take it at the same time every day. If you find yourself not taking your medications as the doctor prescribed, then ask yourself why. So here's some tips of how to remember taking your medications at the right time or every day. I say making a schedule or setting up some sort of reminder system to take your medications regularly is very important. Of course, you can use a pill box for every pill every day, or even using smartphone app reminders. I do have a pill box here that Jenny has provided, and it is a pill box that has Monday through Sunday slots, and then it has morning, noon, evening, and bedtime. So something as simple like this, it can be really helpful in helping you remember your medications, and you can take it with you if you're going out or on vacation. Definitely want to have a designated pill box for all of your medicines. And then if, going to the pharmacy is inconvenient, or, setting up refills is difficult, it's always recommended that if you can, requesting 90-day supplies of your medications. That way you make sure that you always have some on hand and you're never without your medicine. Scheduling your refills if you're able to at the same pharmacy at the same time each month definitely does help make it easier to remember to pick them up too. If you're having any side effects from your medications, it's very important that you tell your doctor about these because there are a lot of options for blood pressure medicines. So if one isn't working or one is making you feel sick, we can always try another one. Regardless, it's very important that you never stop taking your medications on your own. Always talk to your doctor first before stopping your medicines, because if you just stop them right away and your blood pressure gets too high, that can be of concern. Monitoring your blood pressure is also something that you can pretty easily do at home. You can always get a home blood pressure monitor to kind of keep track of your numbers every day. And if you do take them at home, I usually recommend to track your results in a log or a diary so you can monitor your progress and just kind of see what your baseline numbers are. Of course, they measure your blood pressure in the doctor's office, so asking your doctor what your blood pressure reading is always great. Or if you go to the pharmacy, they generally have blood pressure cuffs there that you can use in the pharmacy. This is just an example of a blood pressure log that you could use or something similar to this, always keeping track of the date and time of the blood pressure reading. And the time is actually really important if you take it in the daytime or versus the nighttime. And then logging what your actual blood pressure reading is too. Making healthy choices is something that's also very important and can make a huge difference in terms of your blood pressure. Of course, exercise is always very important. Recommend talking to your doctor about how much the doctor recommends you exercise per week. It doesn't have to be, running a marathon by the end of the first month. It can be, more achievable goals. So, walking a couple times a week for 30 minutes or an hour. And kind of building up from there. Diet is very important, so making healthy choices, eating lots of fruits and vegetables. And then smoking cessation is also a very significant factor to lowering your blood pressure. So if you do smoke regularly, definitely recommend quit smoking because it can actually have a pretty significant impact on your blood pressure. So when you're, choosing foods, like I said, fresh fruit, vegetables, whole grains are your best choices. And we recommend avoiding high sodium, cholesterol, saturated fat, and trans fat. I have a picture of a food label here. So if you've never looked at one, I recommend that you do the next time you go to grab a snack from the cabinet or if you're in the grocery store. But learning how to read these food labels is really important. On the food label, it usually lists how many servings per container are included and what the serving size is. So adhering to that serving size is always important. It lists the calories per serving, things like total fat, saturated fat, cholesterol. Sodium is also a really important one. So, make sure you look at the sodium content and choose foods that are lower in sodium, because that can help lower your blood pressure. The last section that I want to talk about tonight is looking at common conditions leading to hypertension, or conditions that can result as of having high blood pressure for a long time. So some disease states may enhance the risk of developing hypertension due to changes in the body and the blood vessels. So conditions including the following do increase the risk of hypertension. So that includes diabetes, chronic kidney disease, obstructive sleep apnea, and dyslipidemia, which is another word for high cholesterol. There are, risk factors that we can talk about for high blood pressure. There are modifiable and fixed risk factors. So the modifiable risk factors are risk factors that that a person is able to change. They're sort of lifestyle modifications that a person is able to work on or modify to reduce their risk. So those modifiable risk factors include smoking, obesity, physical inactivity, and unhealthy diet. Fixed risk factors are things that you can't necessarily change that increase your risk for high blood pressure. So that includes family history. Family history is a big risk factor for high blood pressure. It does, tend to run in families if you have a relative that has high blood pressure. Older age is another fixed risk factor. We know as the older we get, generally the higher the blood pressure gets. Lower socioeconomic status is a fixed risk factor. Males are more likely to get hypertension than females. And psychosocial stress can be a risk factor for hypertension. So we'll talk about primary hypertension. Primary hypertension is also known as essential hypertension. And this is the most common cause of hypertension in just over 90% of patients. Primary hypertension is typically due to hereditary or a direct factor such as diet or low physical activity. So really looking at those fixed and modifiable risk factors. Secondary hypertension is less common than primary hypertension, and it's caused by other diseases. So these are some diseases that can cause hypertension. Those include a kidney disease, so-called renal parenchymal disease, or renal vascular disease. Obstructive sleep apnea can also cause hypertension, as well as drug use or alcohol use. Other less common causes of hypertension include thyroid disorders, so either hypo or hyperthyroidism, and other endocrine disorders like Cushing's syndrome and acromegaly. So there are many complications of high blood pressure. We sort of, call it a silent disease, because if you're just sitting here, you probably wouldn't realize whether or not your blood pressure was high or low. Typically, if your blood pressure is low, you would feel dizzy, but if your blood pressure is high, you generally feel well. You don't really feel any different. So even though you may feel well, but if your blood pressure is high, that can be very dangerous. So that's why we call it a silent disease. So if you do have high blood pressure, even though you may not feel anything, it is important that you do something to address it, because uncontrolled hypertension can lead to the development of several other diseases, disability, and even poor quality of life. So it can cause damage to the blood vessels and narrowing of the arteries over time. So we'll talk about the different organs that high blood pressure can affect if it's not treated appropriately. So high blood pressure first can damage the heart, of course. And that is because it's limiting blood flow to the heart and other areas of the body, potentially leading to various heart diseases. Those include coronary artery disease, enlarged left heart, heart failure, or peripheral arterial disease. High blood pressure can also be harmful for your kidneys. So kidney disease can develop due to hypertension of blood vessels leading to or inside the kidney itself. So there's a term we call glomerulosclerosis, or that's what we call kidney scarring. That can happen as a result of high blood pressure. Or kidney failure and chronic kidney disease can also be caused by high blood pressure. Could kidney failure ultimately leading to either having to go on dialysis or even renal transplant. Looking at the brain now. So normal brain function relies on sufficient blood supply. Limiting the free-flowing blood supply to the brain due to hypertension can result in various conditions. So for example, stroke, hypertension or high blood pressure is one of the most common causes of stroke in patients. So That's definitely one of the modifiable risk factors that we can take to prevent a stroke from happening. Also a TIA, or what we call a mini stroke. High blood pressure could also, if not treated, lead to cognitive impairment or even dementia. Next, moving to the eyes. So hypertension can also affect the small blood vessels located in the eyes, leading to a couple different disorders. So we could say hypertension can cause retinopathy, which is damage to the retina, choroidopathy, which is fluid buildup under the retina, or optic neuropathy, which is nerve damage. So looking at blood pressure goals, like I said, it's always important that you ask your provider what your personal blood pressure goal is. But generally, for most diseases or most conditions, the blood pressure goal is less than 130 over less than 80. So like I said, this is a lot of information in this presentation. So it's always important that you do engage your healthcare team and your providers, just kind of asking what your individualized goal is and what you can do to achieve that goal, and how your healthcare team can help. And, if medications are the route, they are very effective, but, it's very important that you take them as they are prescribed, and taking them faithfully is always very important. So with that, I think we're gonna leave it or close it for questions now. And then Jenny will demonstrate how to measure your blood pressure using the blood pressure cuff.
So can we unmute? Are they unmuted?
I'm not sure you ask them.
Is the recording stopped?
Okay, you can unmute and ask questions. So I had a couple questions. And one was, with all the medication that is used to relax the blood vessels, is it chosen which one to use, which group or category?
That's a really good question. So, looking at the blood vessels, essentially, you can pick anyone. So our guidelines say to use calcium channel blockers, ACE inhibitors, or the Arbs, essentially as the first line one. Patients with renal disease, generally, we may go with a calcium channel blocker first, because renal impairment can happen with the ACE inhibitors. So generally, it's kind of also provider preference. If they have, one that they always go towards, they will start with that one. Most of the time, like I said, I do see the calcium channel blockers being used first, but we do have national guidelines that, kind of say which classes are the preferred ones.
Okay. Another question is, how often are different types of hypertensive used, the different categories, and how are those choices made, whether it impacts the heart, the vessel, the kidney, etc.?
Yeah, so if you're going to be on more than one blood pressure medicine, generally your provider will put you on, 2 medicines or 3 medicines that work different ways. So they'll put you on one for the blood vessels, one for the heart, and then one for the kidney. So we wouldn't choose 2 medicines that work the same way, just because it's much more effective if we choose it from different, that they target different organs.
And so I guess in terms of the majority, are most people on 1, 2, or 3 medications?
So it really depends on what your blood pressure readings are. If you have a blood pressure readings that are greater than 140 or greater than 90, then you will be started on 2 blood pressure medicines. However, if your blood pressures are only slightly elevated, like 135 or 180 or something like that, generally 1 will be enough. So the number 1, 2, or 3 really depends on your initial blood pressure reading, but also how effective that medicine is working for you.
Okay, thank you.
Welcome.
Any other questions from those who've joined us by Zoom? Well, it's pretty quiet out there. Let me grab the blood pressure cuff and then we'll turn the recording back on.
All right, thank you.
All right, and again, any questions before I complete with the demonstration? Okay, you're a quiet group. You can resume the recording.
Oh, I never thought that.
Okay,
Well,
that's fine. So I know that Kristen was talking about the medication organizer. I don't think she had a chance, or the film or her PowerPoint was up, but wanted to show you this medication organizer. And we do have these available for all participants here in our hypertension workshops. So you'll see that each of these is labeled with a day of the week, as well as a time of day. So these could easily be set up and probably most effectively set up each week, because it also helps you keep track of what medications you've taken. So to pull them all out, organize the medications each week. And then, for example, if you were running errands one day or out for the day traveling, you could take this and simply slip this into your pocketbook or pocket as a reminder to take them throughout the day. But if you were traveling, you could organize and take this entire set of medications with you for the entire week. So again, these are available. We'll make arrangements to get these out to you. Any questions about that? All right, and then I just wanted to demonstrate the use of the self-monitoring device. We've done this each time. But again, this is the Omron. This can be purchased, but I also, for those of you who've had difficulty obtaining one, have these available as well. And please give me a call about that. The cuff gets plugged in to the side of the device. And remember that when you take your blood pressure, you should, particularly in the morning, get up, use the bathroom, and avoid having caffeine or exercising for about a half hour prior to taking your blood pressure. The cuff gets placed on your arm with this tubing going down the center of your inner elbow. So it's placed, and if you can kind of hold it in place while you then tighten the cuff, you need to do that. Tightening it and then pulling it around your arm. If you have to adjust, do so. You should be sitting with your back up against a chair, feet flat on the ground. And then no talking while the blood pressure is taken. There's a start button, and some of the devices you can record for 1 or 2 people. So dependent on which person you're choosing, set that appropriately. Rest your arm on the table so that your arm is about the same height as your heart. Like I said, you're going to be nice and still without talking for that period of time. Once the blood pressure is displayed on your device, we do have these tracking pieces of paper. These are also available to you all. And you would put your date, the time, the systolic, diastolic, and then your pulse to record. A couple of reminders that when you are doing this self-monitoring, you should bring the machine to your doctor's office so that they can compare the results that you're getting with the results that they're getting to confirm that they're consistent. You should also bring your record of blood pressure so that they can see kind of the pattern or trends over time. At this point, are there any questions? Okay, well, the reminder that we have another blood pressure hypertension workshop coming up in 2 weeks, which will be May, let me double check my dates. May 23rd. That'll be with Dr. Mirza on the adherence to high blood pressure therapy. And then we conclude the series on Monday, June 6th, where we'll talk about emergencies and urgencies with hypertension. Again, those will be from 6:30 to 7:30, 8 o'clock on those two Monday evenings. And we'll conclude if there aren't any more questions. All right, thank you for joining us tonight. It's been a pleasure. We hope to see you again in a couple of weeks. Good night.